Welcome to Cicero Unplugged. I'm joined here today by Adam Beazley, who is a consultant in our Public Affairs and Healthcare Department. Adam, you've been at H Advisor Cicero for how long now?
About 6 months.
And previously you were with the BMA.
Yes.
And I'm sure we'll come on to talk about
Certainly.
them before our time is up. We're here essentially to talk about the NHS 10-year plan. It's a week now since it was published. So I'd like us to start talking about delivery and in particular the shift to neighbourhood care.
Certainly. The plan is largely as expected and as briefed, but there is a lot there actually in delivery, even though the delivery plan has been delayed alongside the life sciences plan. But there's plenty in there in delivery, as I said, on making every single trust a foundational trust over time, and bringing in financial incentives for trusts to finally get care out of the hospital and into the community. They will be given financial incentives to reduce A&E attendances, etc. And the NHS runs on money, and how the money flows around the NHS is ultimately how you reform it. And these changes are significant. So Wes has spent a lot of time saying he won't do a top-down reorganisation of the NHS. But he's then gone on to abolish NHS England, and now he's moving the money flows around the NHS to finally move care around. So there's a lot there into actually how they're going to implement it. But ultimately, this is going to take time. This is going to take 2 or 3 years before these financial incentives kick in, and we're then going to be knocking on the door of another general election by then, which for them is, I think, quite a brave move in the sense that the meaningful reform in this plan isn't really going to be meaningfully delivered for several years to come.
And how do you think it's been received by stakeholders?
I think largely positive, because it's largely as briefed, and as Wes has been kind of pitching for several months now about his 3 shifts. There's nothing in there that's hugely surprising, and it was well leaked and well trailed. The question now will be, can they deliver an actual delivery plan, which they should have done as another chapter written by Alan Milburn, which has now been delayed. If they can deliver that soon and provide confidence to the workforce and pharma and other important parts of the healthcare system, then I think they've got a good chance, but it's going to be very difficult.
And what about confidence amongst the most important stakeholders, one would argue, which are the patients, us, the public? How do you think it's been received by them? And crucially, do you think what he's announced will ultimately reduce waiting times?
Well, Wes has made a lot of his recent kind of 12 months in power about engagement with patients, and a lot of the 10-year plan featured patient voices throughout it. So that's an important part of his work. Its reception by patients is difficult to kind of get a good grasp on with all the other noise going around in Westminster over the last week or so. But I think ultimately what patients always speak about in focus groups is that 8 a.m. GP scramble. So if he's finally able to end that, invest a lot in the general practice contracts, open these new neighbourhood health centres, then I think he will kind of impress the patient, as it were. But as I said, that's going to take time.
And in terms of the politics?
Very difficult for him, because he's in an insidious position where he can't impress too much, because that would be quite problematic for Keir Starmer. There's certainly the rockier Keir Starmer's career gets. But I'd be definitely interested in your view on the politics of it, who's far more connected to Westminster than I am.
I'm supposed to be asking the questions, not you asking me. I think Wes is doing incredibly well.
Okay.
He's a very strong performer. But with a fantastic grasp of the issues and policy, because he's been doing it for a long time, and he's a wonderful communicator. But most importantly of all, he's got a fantastic team around him.
Yes.
His ministers, both in the Commons and in the Lords, in his PPS, Zubair Ahmed, he's got a practicing surgeon. Karen Smith knows the NHS inside out. So all in all, I think he's doing really well. And crucially, the Tony Blair Institute, which has in essence been acting as a shadow health policy department.
Certainly.
The changes for pharma.
Yes.
Coming back to the actual plan.
Yes.
Tell me about that.
So, most of it's still to come, because the negotiations around VPAG are clearly stalling and not going very.
VPAG, for those of us who are not up to
is
speed
essentially
with all the anagrams.
What government pays for drugs and medicines, ultimately, if you boil it down. And so there's still plenty to come, but there are still some massive changes in there. Number one, they're going to start retiring medicines, which is a new policy, and is certainly making the ABPI and the rest of the pharma industry a little bit nervous, I think it's fair to say. And then another big shift that they're going to change to a national formulary of drugs. So currently there are local formularies for drugs, which can be different in different regions of the country, and now they're going to move in time to a national formulary of drugs. And I think that's going to create a bit of an all or nothing market. If you're not on the national formulary, you're not going to be able to sell your drugs very easily in the UK. There's a lot to be answered on how easy or how difficult it will be to get on the national formulary. That will dictate how impactful that policy is. From those I spoke with in pharma, they're not as nervous, but it's still going to be a big change. But yeah, the retiring medicines is a big shift, and the merger of MHRA and NICE is something that they're keen to see the detail of. But in principle, most support, and I think is a welcome move, because certainly NICE have been struggling in recent months and are not on the good side with pharma and lots of other charities and organisations.
We talked initially about the BME, and you used to work there. They're in the spotlight again this week with the announcement of a further strike. What's your view?
Yeah, I don't think it's a particularly surprising move. This was certainly been coming. The BMA have spoken about a bank and build strategy to take their pay deal that they got last year further. But I think they're in a much weaker position. That turnout of 55% is certainly going to be worrying. It's a lot weaker than they were 2-3 years ago. And I think Wes is ready for a fight and to kind of wait them out. The Employment Rights Bill reforms are not going to have kicked in time for the BMA to use them. So Wes can wait them out for 6 months, see whether that strike participation rates are strong. And if they're not, he'll probably hold them out. And I think he'll essentially wait to see if they fancy another ballot, and probably slip below that 50% turnout that they need.
Indeed. Adam, thank you very much.
Thank you, Rhoda.